Hello and welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks so much for joining us today for our discussion on the obesity epidemic and improving obesity care. Before we begin, I'd like to thank our sponsor, Eli Lilly, for supporting today's conversations. More than 45% of American adults and about 20% of children live with obesity, and it has become the second leading cause of preventable death in the United States. This chronic disease hits Black and Hispanic adults disproportionately and often leads to type 2 diabetes, heart disease, and other comorbidities. The COVID pandemic has really exacerbated these inequities as well. Over the next hour, we're going to talk about prevention and modernizing health policy, and we're going to examine what gold standard treatment guidelines need to be implemented. We will also dive into the bipartisan legislation currently being considered on Capitol Hill that would improve access to behavioral therapy for obesity and cover anti-obesity medications for Medicare beneficiaries. But before we begin, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag The Hill Obesity Care. We are broadcasting live and we'll take your questions throughout the program. And with any live stream, you could experience trouble. I always love this part. Don't throw your computer out the window. Just refresh the page, and I'm told it will all be well. Joining us to kick off the program is Congressman Raul Ruiz. He was a practicing emergency room doctor prior to his election as a member of Congress. He's a co-sponsor of the Treat and Reduce Obesity Act, also known as the TROA legislation. He's also the chair of the Congressional Hispanic Caucus. Congressman, it's great to be with you, and thank you so much. Look, this topic is one I care deeply about. I have been all over the United States, and I know that the obesity challenge is one that many Americans are struggling with, and they have the cards stacked against them in our society in so many different ways. There's a stigma that makes health care, that makes mental health stress a complication and a challenge as well. And I respect so much that you're trying to help Americans with this. Tell us about the TROA legislation that you are working on and what it will do for those Americans suffering from obesity.
Well, thank you, Steve. It's great to be here. And first of all, as an emergency medicine physician, it is very important that we do something about the obesity epidemic. You know, I see patients day in and day out with complications from diabetes, from cardiovascular diseases that stem from their obesity. In fact, patients who are obese do not survive traumas as much as patients that are not obese, even given the same trauma, just get with the complications of being able to intubate or find central lines, a good artery or vein to infuse IV fluids, et cetera. So definitely we have to get a hold of it. And the TROA Act, the Treat and Reduce Obesity Act, will allow Medicare Part D to pay for or to cover the anti-obesity medications, and Medicare Part D will also include intensive behavioral therapy. And we know from previous studies that if you combine behavioral health and therapy with medication, then you have better outcomes with your obesity plan and treatment.
Look, I've been in some communities, Representative, where I met with those challenged with obesity and just went through all of the life factors that surrounded them, the ecosystem, the contributing factors to this. And it was a fairly staggering tsunami of things that people were dealing with. And I just sometimes feel in our society, we're blaming that person as opposed to helping that person find a way out. And so when you're looking at behavioral, when you're kind of looking at that area, have you seen models in your experience where that has worked? Because I do know that in this country, to be honest, we have an ecosystem problem where a lot of people, this is the reality of it. There are food deserts, there are all sorts of complications in people's lives. And I know the TROA Act doesn't solve all of that, but how much of it can solve? And have you seen cases where behavioral therapy and mental health support and other supports come in and really make a difference for people?
I have, Steve. In fact, there's a lot of mental health issues or even anxiety that can lead to obesity. And then on the flip side, obesity can also lead to a lot of anxiety and some mental health issues as well. So the mental health component of any illness is very important to get a hold of. And in particular with obesity, a lot of times patients will transfer positive reinforcements with the food that they eat, or their coping mechanism is their food, or long-term childhood anxieties, traumas are dealt with by eating or over consuming. So now that's just the mental component of obesity. Steve, there are other illnesses like hypothyroidism and other hormonal illnesses that can lead and complicate and lead to obesity as well. So obesity is a very complex, multifactorial issue, including lack of sleep. If you're not sleeping very well or having adequate, good sleep, then it's going to be very difficult to control your obesity. And some patients gain more weight when they have obstructive sleep apnea, insomnia, or other sleep problems. So a good comprehensive approach to dealing with obesity that goes beyond just calorie counting and exercising throughout the day, that also ensures that patients have access to anti-obesity medications through their insurance companies, and now with my bill through Medicare, and that can access intensive behavioral therapy that can help them understand their illness and how to cope with anxiety without having to go towards high caloric intake, is a very important part of a piece of the puzzle.
Let me ask you a question, because I want to get into the status of the TRO Act, which I know that was introduced in 2012. But before I do that, one of the things that confuses me is that you're setting out the need for Medicare to help pay for the behavioral therapies and some of the drugs and pharmacological aids that could be useful in this. I'm just interested in why it's not already included. Is obesity somehow a set aside? Is it sort of the orphan ailment? You know, kind of think about health of the whole person. Why isn't already in the package?
You know, I think that once the Part D was created, I believe that we did not have a better understanding or as good of understanding of the illness of obesity as we do now. And so now we understand that obesity costs our society over $180 billion a year. About 1,900 out-of-pocket costs for individuals per person on average in the United States. We know it's an epidemic, and we know it's interrelation with so many other illnesses that if we can really get a hold of this obesity epidemic, then we will reduce the incidences of diabetes, of hypertension, of cardiovascular disease, heart attacks, and other issues that come from obesity, and that will not only improve the public's overall health, but will reduce healthcare costs, which is, as you know, very high in our country.
What is the status of your legislation now? Is it part of any of the Biden plans that have come down the pike, or is it something you still need to score? What is the status of TRO at this moment?
Well, Troy, we need to have a hearing in our committees, and I sit on the Energy and Commerce Health Subcommittee, and we're advocating to really push for a hearing in energy and commerce. However, my bill specifically focuses on the Medicare portion, so that would be in Ways and Means Committee as well. And so we're encouraging Chairman Richie Neal to have a hearing as well in his committee. It's a bipartisan bill. We're getting lots of support from members on both sides of the aisle. It is not included in any larger vehicle, but it is something that we are definitely advocating to move through our committees, because overall, although the CBO, and this is the problem with the CBO scores, they do not measure cost effectiveness. And so they may say it'll cost a certain amount of money to cover these medications. But what they're missing, which is very well known in the public health community, is that if you invest in prevention, if you invest in some form of treatment, then you will reduce overall costs, and you will reduce the amount of money that we spend on obesity or the consequences of obesity. Because with a significant small investment per person for those medication costs, then you can potentially prevent a heart attack, congestive heart failure, diabetes, and amputations in neuropathies and loss of work in those patients' lives. And so overall, you're reducing the costs of treatments for obesity and the consequences of obesity.
Look, we're smart enough to do simulations where we can anticipate what investments make and what cost savings there would be. We're sophisticated enough to do it. Why aren't we doing that kind of dynamic scoring?
It's just not part of the economist equations. They're not looking at cost benefits or cost effectiveness. That's the whole prevention dilemma in our country. That's why when we focus on CBO scores too heavily, they're not accurate, and it's going to take some legislation to really remedy that. We know that, for example, let's just look at aeromedical transportation. It costs a lot of money to transport a critically ill patient from one area to another via a helicopter. However, if you don't treat a stroke in a timely manner in a 40, 50-year-old person or a heart attack and transport them as quickly as possible to a cath lab in order to open their vessels, then there's going to be tissue in the brain or the heart that's going to die, and they're irreversible. So you cannot regenerate these new tissues, and therefore they will have lifelong disabilities. And if you measure the amount of treatment and physical therapy and loss of wages throughout their lifespan, then you realize that the cost of aeromedical transportation is very minimal compared to the lifelong cost of taking care of that individual with debilitating illness. It's the same thing with obesity. If we look at the amount it's going to cost for us to treat with behavioral therapy and a medication, then you will prevent an enormous amount of cost from diabetes, amputations, maybe blindness from their diabetes, heart attacks and congestive heart failure, and years of treatment and intensive therapies for the rest of their life.
Well, it's a powerful argument to me. Congressman, we're taking questions from the audience, and we have one from Erica Emerson for you. Erica?
Hello, I'm Erica Emerson, Chief Policy Officer for the Diabetes Leadership Council. The Treat and Reduce Obesity Act is so necessary, and it has widespread support in the patient advocacy and provider communities. Yet it has stalled in Congress for several years now. Would the sponsors please share what the hurdles have been and how, if at all, they're changing up their strategy for TROA in this Congress and administration? Thank you.
Thank you, Erica. Congressman?
Well, that's a very good question, Eric. And I think that right now this Congress has had their hands full with a lot of priorities in the Biden agenda. I do believe that we have a good group of co-sponsors now. I'm one of the original co-sponsors and authors of this bill that was introduced by Ron Kine. We have a strong bipartisan team with Representative Reed and Wenstrup. Wenstrup being another physician on board. We are in the committees that mostly deal with healthcare. So there is a lot of strong advocacy with the team that we have in order to move this along within our committees. And so I'm feeling very hopeful. Oftentimes with a bill like this, it will be combined with larger bills where there are cost savings in order to balance the CBO score. And so I think that that's one of the strategies that we're employing now.
Let me just ask you, Will, finally, because I'll be, as you know, in this program talking to Congressman Wenstrup. And I love the Doctors Caucus. I assume you're in the Doctors Caucus too. Doctors that are in the House, and I've enjoyed talking to many of your colleagues. But do non-doctors get this subject well? Do they understand? How is the literacy about obesity among your colleagues and understanding the seriousness of what you're trying to do in TROA?
A lot of people don't understand obesity, Steve. And going back to some of the original comments about stigma, where people will blame the person for their obesity and just take it as a matter of willpower, is completely false. And this notion of not understanding the full complexity and how obesity is a comprehensive, systematic illness that has so many ramifications really hinders our ability to look at the environments, the different illnesses that can lead to obesity, and then learning that there's such an array of illnesses that are a consequence of obesity can be dealt with by focusing on obesity, and this obesity epidemic is very important. So I do think that we need to make a better effort in terms of the public health education. Most people don't realize that the lack of sleep or not getting good enough sleep can increase your corticosteroids in your body, reduce the ability to slow down your metabolism, cause a lot of damage on your vessels, and lead to obesity as well. So we really need to have a better understanding. And the research is also evolving and giving us a deeper dive on that obesity. And so that's why this bill gives us an opportunity to speak about obesity on the House floor with our colleagues, with committee staff and our own staff, and really comprehensively paint the picture of what it's going to take to beat the obesity epidemic in our country. The TRO Act is a piece of that puzzle, a very significant piece, since nearly 30% of seniors have obesity, and so we also need to make sure that we, when we talk about the treatment, that we include the behavioral therapy along with the anti-obesity medications, so that we can set our patients up for success.
Well, thank you so much, Congressman Raul Ruiz, physician, co-sponsor of the Treat and Reduce Obesity Act and chair of the Congressional Hispanic Caucus. Thanks so much for talking to us today.
It's a pleasure.